Good morning. My name is David Chiu. I'm the City Attorney of San Francisco, and I want to thank all of you for being here today. We are here to announce a first-of-its-kind lawsuit against the largest manufacturers of ultra-processed foods. Ultra-processed foods that are making us sick, plain and simple. These products in our diets are deeply linked to serious health conditions, imposing enormous costs on millions of Americans and cities and states across our country. Our case is about companies who design food to be harmful and addictive and marketed their products to maximize profits. Like the tobacco industry, they knew their products make people very sick, but hid the truth from the public, profited from untold billions, and left Americans to deal with the consequences. Over the years, our San Francisco City Attorney's Office has successfully held accountable industries that profited enormously from products that they knew harmed the health of millions: tobacco, lead paint, opioids. This is our next fight. So what are ultra-processed foods? We're talking about food that is not food, that is not found in nature, created by combining artificial chemicals with industrialized processes. You can see a few of the worst offenders right here. While ultra-processed foods often have high sodium, added sugar, saturated fats, the health concerns are not just the amount of calories, fat, or salt. Ultra-processed foods themselves cause unique health risks because of their chemicals, because of how those chemicals are combined, the processes by which they are made. The industry has created thousands of new chemicals, which the body metabolizes and craves differently. And they are designed to be addictive. Addictiveness is a feature, not a bug. I want to just share a quick personal story. When I was a kid, my mom used Pringles to get me to take swim lessons. And to this day, I love my Pringles. But they are designed to be highly addictive. In recent decades, this industry has flooded the American food supply. Today, they make up 70% of our food supply. There's no one who can completely avoid ultra-processed foods. So what's the harm? Ultra-processed foods have created an enormous public health crisis with skyrocketing healthcare costs. As the consumption of these products has risen, so has chronic disease. Many recent studies and massive data sets have confirmed the very clear link between ultra-processed foods and chronic diseases. Type 2 diabetes, fatty liver disease, heart disease, kidney disease, colorectal cancer, Crohn's disease, depression. And the impact on children has been particularly alarming. Unprecedented levels of obesity and type 2 diabetes. We have reached a tipping point in the scientific research about the harm of these products. Significant studies have been coming out, confirming what we know. Just this month, Lancet published 3 papers. Last month, the Journal of the American Medical Association wrote about it, and so on. International consensus by the scientific community, despite industry attempts over many years to deny, deceive, and literally pay off scientists. Now, how did this happen? The tobacco industry drove the rise of ultra-processed foods. Starting in the 1960s, big tobacco Starting in the 1960s, big tobacco bought major food companies. R.J. Reynolds purchased Nabisco and Del Monte. Philip Morris purchased General Foods and Kraft. In the 1970s, the food industry consolidated. These companies then transferred people, ideas, technology from big tobacco to the food industry. They used big tobacco tactics to research, design, and sell addictive products. They used addiction science and marketing techniques that followed the big tobacco playbook of creating the illusion and erosion of consumer choice. On the marketing front, they bombarded kids with product messages and advertising with cartoon mascots, from Tony the Tiger and Fred Flintstone to Paw Patrol. They used integrated marketing strategies with toy manufacturers and child-focused media companies, from Disney and Nickelodeon to Mattel, Nintendo, and Marvel. and they specifically targeted low-income communities of color and their kids. And I'll just note that this is not just about what we think of as junk food. Many ultra-processed foods don't seem unhealthy, but they're falsely marketed as healthy. The most damning aspect of all this is, like the tobacco and opioid industries, the ultra-processed food industry had actual knowledge that their products caused harm. In 1999, as is laid out in our complaint, the CEOs of the largest U.S. food companies met. Pillsbury Kraft executives warned industry leaders that these ultra-processed foods had gone too far. They predicted devastating public health consequences, health conditions that would cost our country $100 billion a year, a public health toll that would rival tobacco. Those warnings were ignored. Just last week before Thanksgiving, the public learned that a Campbell's Soup executive was caught on a recording in an hours-long rant describing their products as highly processed food for poor people. I suggest you listen to it. These companies know their products are harming people, but they continue to design, market, and profit off them, particularly at the expense of our kids. So our lawsuit. The companies we are suing today include Kraft Heinz, Mondelez, Post Holdings, Coca-Cola, Pepsi, General Mills, Nestle USA, Kellogg, Mars Incorporated, and ConAgra brands. We are seeking to hold these companies accountable for their unfair and deceptive practices, for violating California's unfair competition law and public nuisance laws. We're seeking to enjoin deceptive marketing and to obtain restitution and civil penalties to recover the enormous costs borne by governments, public health costs that stem from chronic diseases due to ultra-processed foods. Our reliance on ultra-processed foods is decades in the makings. While we are not going to be able to reverse that overnight, this lawsuit should be the beginning of how we ensure accountability. We have a number of speakers today, and again, I'm just very appreciative of all the folks that have come together on this topic. I'd like to introduce from the San Francisco Board of Supervisors, Supervisor Shimon Walton, who has been a leader in our public health space. He has led bold policies to stop large industries from preying on our communities, particularly communities of color, with their harmful products. Supervisor.
Thank you, City Attorney Chiu, and again, good morning to everyone, and thank you so much to our medical professionals who are here. I want to appreciate City Attorney Chiu and his office for bringing suit. As you know, we have to do everything we can to, one, protect our communities and fight the deception of big corporations who intend harm, particularly on our most vulnerable communities. And we know that our communities have lived with the consequences of ultra-processed foods, as well as other attacks for too long. These products have shaped diets in ways that fuel chronic disease and place the heaviest burden on working families, low-income neighborhoods, and communities of color. When an industry prioritizes profit over public health, government has a responsibility to step in, demand transparency, and to protect its residents from harm. If we want a food system that puts people first, we have to start with our own house. City departments serve food every single day in shelters, jails, youth programs, long-term care, and community-based services. That means thousands of San Franciscans rely on us for meals that should promote health and dignity, not contribute to the very conditions that we are trying to eliminate. Today, we will introduce a resolution at the Board of Supervisors meeting that is about understanding where ultra-processed foods show up in our system so we can lead with integrity. San Francisco cannot call for accountability from corporations while ignoring the impacts of the foods that we distribute. Addressing this harm at its source begins with city government modeling the standards we want to see across the country. This is how we advance health, equity, protect families, and ensure San Francisco is leading by example. Again, I want to thank our City Attorney, David Chiu, for his leadership and for taking bold action to hold this industry accountable. His work in this fight makes it clear that San Francisco will not sit by while corporations profit from products that harm our residents. This effort creates the foundation for stronger public health protections statewide, and it reinforces why it is so important for the city to examine our own practices. I look forward to working with the city attorney as we move forward in this fight to protect our communities, and just again want to thank you all for being here today. Thank you.
Thank you, Supervisor Walton, for your partnership in this work. San Francisco has led when it comes to moving forward on public health issues, and I want to bring up as our next speaker our city's Director of Public Health, Dan Tsai, who previously led our nation's Medicaid program at the Centers for Medicare and Medicaid Services in Washington, and he is super familiar with the costs of the health impacts caused by ultra-processed foods to local, state, and federal government.
Thank you. Good morning. I want to thank the city attorney for raising this issue and bringing suit, supervisor and others here. The reason why this is so important to us at the Department of Public Health here in San Francisco is because our core mission and vision is to make sure that San Francisco is the healthiest place on earth, not just for some people, but for all people. And what the data show us are that the leading causes of mortality in the city are heart disease, even more than overdose in some cases, heart disease, diabetes, and other related chronic diseases. The impact, the mortality of those diseases are also disproportionately felt within communities of color. The average life expectancy in San Francisco today is 82 years. The average life expectancy for Black and Black African Americans in the city is 66 years. That is unacceptable. When you look at the drivers of what leads to that delta, that difference in mortality in lost years, and you look at the causes of mortality, heart disease, diabetes-related conditions are clearly related to that. I do not believe it is possible to make San Francisco the healthiest place on earth for all people without also looking at and addressing food, because food is health. And you will hear from our subject matter experts in the city and clinicians and researchers and all across the country the very compelling linkage between ultra-processed food and the addictive nature of that and the downstream health outcomes and mortality and other things that I've just noted. And communities of color, low-income communities have been disproportionately impacted on this. I also want to note some of the financial costs and other health outcomes that we as a system face. By 2031, healthcare spending is expected to reach $7 trillion. Much of that burden is borne by states, cities, and the public healthcare system in the United States. Between Medi-Cal obligations, employee health benefit obligations, public health initiatives, the state of California and San Francisco are spending billions of dollars a year on healthcare. In 2024, Medi-Cal accounted for approximately $124 billion in expenditures. 3.95 billion of that expenditure is attributable to San Francisco. And diabetes was one of the leading causes of death and hospitalization in San Francisco between 2017 and 2021. As we've rolled that data forward, that continues to play out, as is heart disease. And diabetes is a major contributor to a whole range of heart disease. Hospitalizations from diabetes, hypertension, heart disease were substantially higher for communities of color than across, and low-income communities than across all of San Francisco. All that paints a very compelling picture for San Francisco to be the healthiest place on earth for all people. For us to think about the public health burden and human impact and financial impact on the public health system, we have to look at food, which is a core part of health, which is why I and we at the department are very grateful for the city attorney and everybody here for really taking this on. Thank you very much.
Thank you, Director Tsai, for your leadership. So our San Francisco City Attorney's Office, we are joined in this lawsuit by 3 outstanding private law firms. Andrus Anderson, DiCello Levitt, and Morgan & Morgan, all of which have extensive experience fighting industries that harm public health. I'd like to invite two of those attorneys to speak today, Fu DeBras from DiCello Levitt and Renee Rocha from Morgan & Morgan.
Thank you, City Attorney. Good afternoon, everyone. Let's move over. Come on, Renee. It is truly our honor to stand with the City Attorney and the attorneys of San Francisco, Yvonne Mayer, Sarah Eisenberg, Ronald Lee, and Jesse Lanier. It takes a great deal of courage to make a decision to move forward and to tackle such a crisis for the city of San Francisco and to set an example for people across the country. This case is as personal as it gets. Philip Morris and R.J. Reynolds, the biggest of the big tobacco companies who unleash tobacco addiction and cancer on our communities, decided to use that same technology, all their money, all their cunning, to use that same science to create a whole new type of quasi-food, which is what this is, UPFs or ultra-processed foods. Without your knowledge and secretly, tobacco has hijacked our food system for decades. During this time, they've used psychological and marketing techniques that they developed for marketing and selling cigarettes to make and sell UPFs to the citizens of San Francisco with a specific eye to selling UPFs to children. Big Tobacco, now acting as Big Food, did all of this with the sole focus of making UPFs a staple of the American diet, despite their own absolute knowledge of the real health and societal damages that UPFs cause. Their sole focus, to make money. But they did that by knowingly placing the health of the people of San Francisco and the health of Americans at severe risk. We've all gone to the supermarket believing that we are buying food in the manner that we've understood food to be for thousands of years, but actually we've been unknowingly purchasing UPFs. We reasonably relied on gross misrepresentations and lies by the defendants that UPFs were food and that they were convenient, and in many cases that they were healthy. But now we know that not only were those representations untrue, but that these commonplace products, gummy fruit snacks, Pop-Tarts, Hot Pockets, ready-made meals, and liquid cheese products actually change the way our children's bodies process food, and that these physiological changes were by design and with devastating effects to the people and the children of San Francisco. As you will hear shortly, my co-counsel Renee Rocha will provide additional context as it relates to UPFs, but we are very grateful to stand with the city attorney and the people of San Francisco in taking a historical stand in a historical case that will change the future of our children and grandchildren. Thank you.
Thank you. Even though they're everywhere now, UPF have not been around for very long. They're new and alien to our bodies, and the science is undeniable. Ultra-processed food causes type 2 diabetes in kids. That disease never existed in children prior to the invention of ultra-processed foods. Ultra-processed foods are driving the obesity crisis in San Francisco, California, and the United States. And they're driving cardiovascular diseases and early death. As we allege in our complaint, the defendants here, including food companies that were owned by the tobacco companies like Kraft Heinz, Mondelez, Post Holdings, knowingly created dangerous and addictive products. We also allege that they have persistently hidden the truth and lied about the effect of these products. They have caused a public nuisance and a public health crisis in San Francisco and beyond. And today, the city of San Francisco and the sovereign people of California stand up and say, enough. It's time for accountability and justice, and time to create a brighter future for our children, one with food that nurtures instead of harms. Today marks a major milestone in the history of public health, and we are confident that San Francisco and the people of California can help guide us into a new and better era. We appreciate their courage and are honored to be working on their behalf. Thank you.
Thank you. Our final speaker today comes from the medical establishment. San Francisco, we follow the facts, we follow the science, and we certainly listen to our doctors. We have a number of pillars from our medical community here, and I want to thank Dr. Sarita Sanpathy, who's an internist, Dr. John Ma, who's a surgeon, and I'd like to bring up Dr. Kim Gruel-Green, who is an associate clinical professor at UCSF, to discuss the harms of these products that she has seen throughout her career as a physician.
Good morning, and thank you so much, Attorney General, City Attorney General. My name is Dr. Kim Gruel-Green. I'm the past president of the San Francisco Marin Medical Society and a trustee of the California Medical Association. But I'm speaking here today as a pediatrician and a mom, where I am terrified about what ultra-processed foods are doing and have done to our kids and families. I see every day how they are impacting our kids, my patients, and all of our families. Research has shown that these foods now make up nearly 70% of the calories in children's diets in the United States. That means that most of what our kids eat does not resemble nutrient-rich foods like fruits, vegetables, and lean proteins, which are essential for growth and brain development. Adults consume more than 50% of their calories in these UPFs. Mounting research, as you've heard, increasingly links these ultra-processed foods to severe diseases. We've heard about obesity, type 2 diabetes, and cardiovascular disease. And even mental health and cognitive function are impacted in conditions like depression and ADHD. I have seen the unrelenting rise of these conditions in younger and younger children in my practice. I fight this every day in my household, and I am losing because these foods are so exciting and addictive to our kids. And this is not just a matter of me asking my kids and patients to make healthier personal choices. Aggressive marketing, low cost, and easy availability make ultra-processed foods the default option for many families, especially those in underserved and underrepresented communities. The consequences are profound: higher rates of chronic diseases, poorer academic performance, and long-term health costs for our city, our state, and our country. We must act, and I'm so grateful to be here standing aside this group. Like the successes of litigation against big tobacco and big soda, today's lawsuit is an important step towards holding food companies accountable for profiting for products that put our health at risk. Let's stop these companies from poisoning our children and our family. Thank you.
Thank you, Doctor. As we conclude and happy to open up for questions, I want to just take a moment and thank the incredible professionals in my office for their work. That includes Jesse Lanier, Ron Lee, Sarah Eisenberg, Yvonne Marais, and others. And I just noticed I've forgotten that someone had left my favorite can of Pringles underneath this, just on a random shelf. But as I mentioned before, when I was growing up, my mother used to bribe me with Pringles to get me into the pool to take the swim lessons. I still crave them to this day, but just in recent months, I've learned about the specific harms of just this product alone that has been written about. So with that, if anyone wants some, you can take them off my hands. We're happy to answer any questions. Or, okay, go ahead.
Why are you bringing this lawsuit now?
So a couple reasons. First and foremost, the science has really tipped here. There have been studies for many, many years, but all the massive data sets, all of the studies around the world show the link between ultra-processed foods and all of the horrific public health impacts that we've been talking about, the cancers, the diseases. It's almost every month that we are hearing from another reputable medical journal about this link. There are now many of these studies. The data is irrefutable.
Elizabeth Cook with CBS News. The VP of the Consumer Brands Association says there's, quote, no scientific definition of ultra-processed foods, and these companies are making efforts to make their products healthier and safer by adding protein and fiber. What's your response to that?
So we've heard that from the industry. The industry likes to quibble on whether there's a definition or not. There's a very clear understanding of what ultra-processed foods are about. We're going to get into that in this lawsuit, but what we know is that there is an entire category of foods that represent 70% of the American food supply that is making the public sick. And that is what this is about. There are definitions that are out there that we will discuss in the lawsuit. It's referenced in our complaint, but we look forward to having that discussion in court.
The Consumer Brands Association is saying that these companies are keeping grocery prices down for consumers. Is there a way to provide healthy food at an affordable price for families?
First of all, absolutely. There are plenty of examples of affordable foods that are not ultra-processed, but I would say that diabetes is unaffordable. Heart disease is unaffordable. Obesity is unaffordable. These industries are peddling products that have caused Americans to be addicted and are leading to long-term costs that are absolutely unaffordable for all of us and are unaffordable for city and state governments around the country. I don't know if anyone else wants to add anything to that.
Just a follow-up question. Are you seeking to change marketing practices? Are you seeking to remove certain ingredients? Are you seeking to limit sales? I mean, this lawsuit.
So there's nothing about the lawsuit that would ban any products, but it is our perspective that this is an industry that is engaged in highly deceptive advertising. So we're certainly looking to address advertising, and we certainly want to ensure accountability on the part of industries that has created enormous costs on society, on public health systems, on human beings. So we'll be looking to get accountability for those costs. Anyone else?
Does that look like monetary compensation or?
Absolutely, we will be seeking monetary compensation. Any final questions? If not, we have a bunch of folks here who are happy to do interviews. And with that, again, I just want to appreciate everyone standing with us and others who have worked with us on the filing of this lawsuit. The story will continue. Thank you very much.